respected faculties and students. Myself, PARMAR SMIT. I am in second year Bachelor of Physiotherapy from Marwadi University, Rajkot. So today is my rubrics 2 video presentation, and for today's subject is pharmacology. In pharmacology, our topic is use of insulin in diabetes. So let's start first with introduction. Insulin is a hormone that manages blood sugar levels by helping your body use glucose for energy. When starting insulin therapy, the goal is to mimic the pancreas's natural function. Treatment typically begins with a once daily basal insulin utilizing specific gradual dosing protocols to safely lower blood sugar. Mechanism of action. Insulin binds to receptors on the surface of cells like muscles and fat, activating pathways that signal the cell to absorb glucose from the bloodstream. It lowers high blood sugar hyperglycemia by driving glucose into cells for fuel and stopping the liver from releasing extra glucose. Types of insulin. Insulin comes in a manufactured forms that vary by how quickly they start working and how long their effects last. Basal, long acting, works over 24 hours to provide consistent background control. Examples include insulin glargine and insulin degludec. Prandial, mealtime and rapid acting, starts working in 10 to 15 minutes to control blood sugar spikes after eating. Examples include insulin lispro and insulin aspart. Starting basal insulin, most guidelines, including those from the American Diabetes Association, recommended a straightforward weight-based approach for type 2 diabetes. Initial dose, usually calculated as 0.1 to 0.2 units per kilogram of body weight, or a standard starting dose of 10 units per day. Starting basal insulin. Titration. The dose is adjusted in small increments. Example 2 to 4 units every few days or once a week until your fasting blood sugar fills into the target range. Monitoring. Regular self checks with a glucometer or continuous glucose monitoring (CGM) are used to safely find the correct dose. Types of insulin. Rapid acting insulin lispro, insulin aspart. Short acting regular insulin. Intermediate acting NPH insulin. Long acting insulin glargine. Indication for insulin therapy. First, type 1 diabetes. Insulin is essential for survival because the pancreas produces little or no insulin. Lifelong insulin therapy is required. Type 2 diabetes, used when diet, exercise and oral medications do not adequately control blood glucose, may be needed during severe illness, surgery, pregnancy, or when blood glucose is very high. Gestational diabetes. Insulin may be prescribed when blood glucose cannot be controlled with lifestyle measures alone. So it is including in gestational diabetes. Benefits: controls blood glucose levels, prevents acute complication such as diabetic ketoacidosis, reduce the risk of long-term complication affecting the eyes, kidneys, nerves and blood vessels. Adverse effects: hypoglycemia, low blood sugar, the most common side effect. Weight gain, injection site reaction, lipodystrophy with repeated injections at the same site. So symptoms like diabetic foot injection, permanent kidney damage, cerebrovascular disease, heart attack. Administration: because insulin is a protein, it cannot be taken as a pill. Your stomach would break it down and must be injected into the fat beneath your skin. It is commonly administered using a discreet, easy to use insulin pen or vial and syringe. Common injections site include the abdomen, staying 2 inches from the belly button, the thighs or the buttocks. Routes of administration: subcutaneous injections most common, insulin pens, insulin pumps, intravenous insulin is emergencies. It's so easy to remember administration: nasal, oral, pulmonary, subcutaneous and transdermal. In summary, insulin is the cornerstone of treatment for type 1 diabetes and is used to type 2 and gastrointestinal diabetes when blood glucose cannot be adequately controlled by other measures. So it is all about of insulin, for use of insulin in diabetes. I hope you can understand easily and clearly. Thank you.